Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and inhuman." Of all the forms of injustice in health is the most shocking and inhuman. Dr. King's words remind us that access to health care is not only a scientific and business challenge, but a fundamental question of justice. Few areas touch people's lives as deeply as their health, and ensuring that life-saving treatments reach all who need them is one of the defining responsibilities of our time. No problem, Brooks, we love you. On behalf of Boston College and the Carroll School of Management, welcome to the Boston College Chief Executives Club. The responsibility of access to health care calls on leaders in science, medicine, and business to push the boundaries of innovation while never losing sight of equity and inclusion. It challenges us to match policies, discoveries, and breakthrough technologies with compassion needed to ensure that these breakthroughs serve not just the privileged, but communities everywhere. And I can assure you that we'll hear more about access on today's stage. I'm thrilled to remind you that you should be receiving invitations soon to our upcoming event on November 6th with Adina Friedman, the CEO of NASDAQ. We will return to the Boston Harbor Hotel, so don't show up here unless you want to, but will be on November 6th at the Boston Harbor Hotel. Now, for today's program, we're thrilled that our host is Jean Hynes, the CEO and managing partner of Wellington Management, one of the world's largest independent investment firms. Jean is the 5th CEO in Wellington's history and the first woman to hold that title. She joined Wellington in 1991 directly out of Wellesley College and has spent 3 decades there and has built a deep expertise in the healthcare sector and has led one of the largest global health care funds. And she has been recognized as one of the leading influential people in business and finance. Obviously, we are honored to welcome our keynote speaker today, Robert A. Bradway, Chairman and CEO of Amgen. Since becoming CEO in 2012 and Chairman in 2013, Bob has led Amgen through a period of remarkable growth and innovation, advancing science to address serious issues and expand access to patients worldwide. Before joining Amgen, he was a managing director at Morgan Stanley in London, and today he serves on a variety of boards, including Boeing, W.M. Keck Foundation, the Pharmaceutical Research and Manufacturers of America, and the University of Southern California, among others. And like so many leaders, not surprisingly, he was educated right here in the Commonwealth. He got his undergraduate degree at Amherst and his MBA across the river in Cambridge at Harvard. Please welcome Jean and Bob to our stage.
That's a big step.
I know. So, Bob, thank you so much for being here with us.
Thank you. Thanks for having me.
A fun fact on my part, I started in this industry in 91 and following biotech and pharmaceuticals in 93. And in 1995, my first set of my own coverage was Biogen, Amgen, Chiron, and Genentech. So
wow.
Only 2 exist right now, but those were my very first stock recommendations. So it feels like I've been researching Amgen my whole career. So I think we're going to learn a lot. And for those of you who don't know, like Amgen really was, for those of you who know a lot about the biotech industry, there are probably 600 or 700 public companies and 1,000 plus private companies, but it really all started with this company right here, which really was the pioneering biotech company. But before we get into that, let's talk about you as a person and your journey. We're going to talk more about the strategy of Amgen, but let's start with you. So let's talk about, like, just give us a little bit about your background and your journey to get to Morgan Stanley and then to Amgen, two great institutions.
Well, Boston played a role in both. So I graduated from college in 1985, which was the era of biotechnology. You know, the foundational experiments that created the industry happened in the 1970s, late 1970s, for example. And an area of interest of mine in college was differential gene expression. And the leaders in that field were, of course, based here in Boston at Harvard, and they'd started a company called Genetics Institute. And so my early days in science and business converged as I had an opportunity to work with Genetics Institute and to begin to discover what the science or the business of science looked like. So whereas I thought I was headed off to a career in medicine and maybe even a career as a physician scientist, I discovered that what was happening in business was very exciting, and so I decided rather than pursuing the medical school after all, I would withdraw from that idea and pursue a career in business. So that's what I did, and after 20 years in finance, I had an opportunity to return to what was my first love, and that was biotechnology, and had an opportunity to work directly inside Amgen, taking a role in operations. But the foundation of my interest in biotechnology was originated right here in Cambridge, Massachusetts, as I came to know Genetics Institute. Again, a rival of Amgen. So I was paying attention to Amgen as far back as 1985, and it was a company that I admired for a long time before having the chance to join them in 2006.
Not even a rival, right?
Well,
a defining court case of the industry.
Yeah, that's right. So as Jean said, there are two biotech companies from the original revolution that still exist as independent entities today. Biogen here in Cambridge and Amgen in Southern California. So we are the two remaining independent biotechnology companies from that first wave.
So you began your career in investment banking. So let's talk about a little bit about what you learned from that part of your business career, and then how did you transition then to Amgen?
Well, I think what I had the opportunity to see the industry writ large. You know, most people who come up inside an organization like ours are like Jean. They've 30 years in a single organization, and they acquire great expertise inside that organization. I had the opportunity to look across organizations in the industry and to try to understand how and where value was being created. And so that was a little different from the typical background inside a company like Amgen. So when I joined Amgen, I joined as somebody that had different perspectives, different insights that were based on, again, my years of studying the industry from the outside. What I needed, of course, was an opportunity to learn the industry on the inside, and I was very fortunate to have been given that opportunity at Amgen and never looked back. And
why did you choose Amgen? Because you could have gone to many different kinds of firms.
I had some opportunities to go to other firms, but I admired Amgen. It was always a company that had intrigued me, as I mentioned earlier, as far back as the mid-1980s. And I admired the company's extraordinary success. There were some things about the company that I hoped would be true when looking at it from the outside, and those things are the extent to which the staff were aligned around the mission of the enterprise, for example. And as I got to know the company, I discovered that it wasn't, the things that made Amgen special weren't just words on a page or words on a wall, but the words that were on the page, on the wall of the organization captured what it was actually like to be there. And so I wanted to be part of an organization that believed it was doing something that mattered, and I found that Amgen was full of people all around the world who deeply believed in the mission of the enterprise, which is to serve patients. And our particular belief is that we want to serve patients that are suffering from serious illness, in particular people who don't have otherwise have good choices available to them. So we want to be pushing the frontiers or the boundaries of biology and biotechnology to offer better solutions for people that are seriously ill.
So it wasn't just the California weather.
No, it was, in fact, California was almost a concern before I moved out there. I wasn't sure that I wanted to live in Southern California for reasons that I'm not sure I can replicate today what in the world I was thinking about. So California has been a bonus, so it's a pleasant surprise.
All right, so you said you started in operations, and then you moved to be CFO and then CEO. Talk about that journey and what you learned in each of those positions that sort of prepared you to be CEO.
Sure, and again, for those who don't know our industry or the history of our industry, it might seem strange that I would have started in operations, but biotechnology got its start in operations. So biotechnology unlocked the secret for how you can manufacture these complex medicines, proteins, that can't be made, for example, in chemistry labs. They have to be made in living cells. And so it's the art of manufacturing these medicines in living cells that gave rise to, and the science that gave rise to our industry. So it struck me, and fortunately the team that was involved in bringing me to Amgen, as a great way to come inside and really learn the business, not quite from the ground up, but learn a core part of what made our organization hum. So many companies in fact, there are only two companies in the industry. Again, it's Amgen and Biogen. Only two companies in the whole global industry that have never shorted a patient for a product. So we take very seriously our responsibility to have medicines available when a patient with a serious illness needs the medicine. And the fact that so many people are shorting medicines reflects how difficult it is to do that. And so again, the pride and the skills and the capabilities of Amgen's operations organization, it was important for me to discover that early in my tenure at the company. We think of operations as a source of competitive advantage, not as a cost center. Others in the industry take a different point of view. I'm sure they have good reasons for that. But again, I was fortunate to start in operations, in a function that I think is deeply important to why we are successful today. We were able to acquire companies, for example, who couldn't figure out how to manufacture enough of their medicines on their own. We solved those problems. We created value for our share owners by doing that. And so that's a core part of what we do. And then, as you said, Jean, I became CFO. I wasn't necessarily expecting that, but I became CFO, and that was obviously a role for which perhaps I was more naturally suited, having spent 20 years in finance. And then fortunately had an opportunity after that to take on broader management and leadership responsibilities as president and then as chief executive.
Yeah. I think I remember meeting you in Thousand Oaks on one of those bus trips we were talking about, and being in the conference room, and you coming in and being such a presence, right? Like such a presence, and sort of modernizing. Maybe that when I think about you, it's sort of you were maybe the modernizing of Amgen, right? Because Amgen had kind of grown up as this small company that won this big patent case that was great at manufacturing, and sort of your era was, and plus others in the field, others at Amgen, allowed it to become the company it is today. Like
the first steps in globalization. How do you think about that? It was fun joining Amgen in 2006. I felt like the company still had a startup feel to it, even though it was at that point 20 years old, or more than 20 years old, 26 years old. It still had that feel of everything was going so well. The revenues were growing, earnings were growing, patients were benefiting from our medicines. It felt like the trees were going to grow to the sky. And then, like every company, we had some setbacks and we had to adjust. And fortunately, we had a leadership team that recognized we needed to adjust, and we did. And so we made some corrections to the things that we were spending time on, and set about trying to globalize the business, and we've been able to do that. We set about trying to expand the areas in which we could contribute. So our therapeutic areas expanded through time, and we remain committed to, again, the patients and the idea that what we really need to do is innovate. So for us, that means bring innovative medicines that have a big effect size for people suffering from serious disease. And our deep conviction is if we can do that, we have a value proposition that works for society, for patients, for our shareholders. And so we have grown considerably. And you're right, Jean, it was a different era at Amgen. We were a bit like the teenager in the NBA, I guess. We had big financials, but we were still growing into our frame.
So talk about becoming CEO, and you're in your 13th year, I think. So how do you?
Does it show? Am I looking gray now, Jean? Is that?
No. So just talk about the journey of CEO, and obviously, if you said you didn't expect to be CFO, you probably didn't expect to be CEO either. So
that's right. I mean, I certainly didn't expect that I was going to go from CFO to president in the way that I did, and so that was an adjustment. I didn't expect to become CEO when I did, so again, that was an adjustment. But I was very fortunate. I think few CEOs are as lucky as I was. I had an extraordinary mentor, by the way, who, when he left the role as CEO of Amgen, came to Harvard and taught for 7 or 8 years, and still is very engaged in teaching CEOs and coaching CEOs. But
you want to say who that is? Who's your
Kevin
mentor?
Scherer,
Yeah.
Kevin Scherer, Professor Scherer, for those of you
Yeah.
who knew him down the road. But so I was in the presence of, for example, a CEO who mentored me damn near every time we interacted, and it was, as Jean can tell you from Kevin, it wasn't glancing mentoring, it was direct,
Yeah.
Purposeful mentoring.
Yeah.
So I was very fortunate, and also had an extraordinary, Kevin had an extraordinary team around him, which benefited me, some of whom, again, I was fortunate, were willing to stay on and help me in my early days. So, I felt that I was pretty well prepared. I see other CEOs who maybe inherit the role in an abrupt manner and haven't had time to be groomed for the transition. I think that's tough. I think, having a time to be made ready is worth something in large global enterprises like ours.
And what were some of the lessons? Like if you think back to 1 or 2 of those direct Kevin lessons.
Well, maybe I'll start with one that's shocked me then and may shock some of your audience now. Kevin said to me at the time, look, CEO makes 6 decisions a year. I thought, what's wrong with this guy? 6 decisions a year. He makes decisions all day long. But his point was that you have to have a good team, and the team has to make the decisions that the team's responsible for making. Don't let them bring their decisions to you. If they're bringing their decisions to you, you got the wrong team. But if you have the right team, you're going to make a fixed number, whatever it is, a small number of decisions, but they're all going to be big, and they're going to be important, and when they get to you, they need to be made. And so the so what of that for me was I figured, all right, well, he's a lot smarter than me. He makes 6, maybe I have to make 9. But the key thing was the observation was you got to be ready for them. You never know when it's going to happen. You don't know when a pandemic's going to arise. You don't know when some major safety issue inside the company is going to derail you for a period of time. So you have to be ready. And I think that was an adjustment for me coming from financial services where we just kind of go around the clock. The idea that being in CEO role required me to be operating at a different cadence than perhaps what I was otherwise used to was something that I had to adapt to. So that's one. But I think the other thing I learned from Kevin and from the team that he built was one of the most important things in leading a large global organization is alignment. So we start a lot of our leadership meetings talking about needing to have shared reality. So making sure that we all see the world, in a shared common way, so that we're aligned in what we see happening. We have to embrace reality, not as we wish it to be, but embrace reality as it is. And I think it's a characteristic of good leadership teams that they operate that way. So again, the idea of having alignment and then being able to communicate through an organization in consistent fashion, so everybody knows what the few key priorities are for the enterprise. And I think sometimes, particularly young leaders, are prone to trying to focus on too many things, and an organization gets confused. When you get a couple levels away from the CEO, it's hard for people to keep track of. Well, wait a minute. Last week it was something else. This week, it's vanilla. What's it going to be next week? And so I learned before coming into the role the importance of bringing along a global organization of tens of thousands of people, and the cost of not bringing everybody along as well aligned as you can is a lot of disruption. And the flip side of that is it takes time to get people aligned, but once you have them aligned, boy, you can really move out and achieve great things. And I think that's part of what we've enjoyed is the idea that we're aligned as a group and we get stuff done as a team globally as a result. And that's really gratifying.
One of the things just in my early tenure as CEO that was, because of being an investor, you're making decisions all the time, right? Like you know this, we have to make decisions all the time. A lot of people are uncomfortable making decisions. They like to opine. But so that's also probably one of the things. Like, how do you teach not tell people to be comfortable being accountable, right?
Yeah, that's right.
Yeah.
And again, I think I'm perhaps fortunate that a culture was created before I took on the role that included a set of leadership attributes that require accountability. That require leaders to establish priorities for their teams and be accountable for achieving the objectives that go along with those. So, some of that, again, has served me well. And I always say to new leaders that they need to take stock of what I call the social architecture of the organization, and where there are problems in the social architecture, that's your first job as a CEO. You got to fix that first. because you can't build a business on a shaky foundation. And this foundation is what I like to call the social architecture. In our case, there are 5 things: the mission that I've already mentioned, aspiration, values, leadership attributes, and strategy. And those things work together. And you know, if any one of those things are out of balance or not right or not well understood in the organization, you have chaos. But if they're pretty well understood and there's alignment around those things, then you can move as a, you know, as a group of 20, 30,000 people. And when you see it, when you see 20 or 30,000 people all rowing out in the same direction, it's exciting. So.
This is not planned, but I'm going to ask you an off-the-cuff question, because we just talked about sort of decisions. You're not going to make that many decisions. If you think back on your 13 years, are there 1, 2, or 3 things that the decisions you had to make or your small team had to make that you think have been defining moments for Amgen?
Sure, there are. You know, I think if I look back early in my tenure, I think about the patent expirations that we were going to face. The beauty of our industry is, you know, we have patent protection for some period of time. The challenge of our industry is when those patents expire, you know, the revenues and the products associated with them plunge. That's our quid pro quo with society. In exchange for our doing, you know, leading edge research, where we establish safety and efficacy, we're granted intellectual property, and we can enjoy the benefit of that intellectual property for a period of time. But after that time, we have to make it freely available to others to copy what we do. So you know that when you hit a patent expiration, you're going to lose, you know, sales and earnings. And I remember early in my tenure doing the math and, you know, studying and saying, gosh, you know, we're headed for an interesting period of time. But, you know, fortunately, I was looking.
I was modeling that too.
You were following that, yeah. And I was looking far enough ahead. That's, again, I think that's a really important lesson. But I was looking far enough ahead to know, okay, I've got time. We have time. And we have time to build alignment around the fact that when these patents expire, we're in trouble if we don't make changes. And so we set about trying to make sure, first with, you know, small teams and then cascading groups, that everyone understood that that's the reality. That's the reality we have to embrace. We can pretend like it's not going to happen. We can wait until it happens and decide what we do, or we can figure it out now. And, you know, one of the things we talk about at Amgen is, again, we're one of 2 independent biotech companies in our industry that, you know, has you know, made it through all these years. And one of the ways you maintain your independence and ability to do what we love to do is by delivering for your shareholders, including through the difficult times. So that recognition, that acceptance enabled people to line up together and say, okay, we need to make changes. Let's agree what changes we need to make. And then we did something that most leaders might, you know, don't enjoy doing, which is what we like to do, you know, what they teach in CEO school, all of you know this, they teach you to give orders and let people go do things, right? I'm not sure that works very well at Amgen, but what does work well is co-creating solutions. So we say, okay, here's the problem, let's work on coming up with a solution together. Let's figure out, let's have an open, fair process for reviewing the things we could do, and then let's agree what we should do, and then let's go do it. And that's the process we took. So we made dramatic changes to the company over a period of 18 months. We substantially increased the operating margin. We launched 9 new products. We expanded internationally, and we did all of that despite the fact that products were coming off patent, and we were having to work through the loss of those operating profits. And so, you know, it was more than a 60% turnover in the operating profits during that window of time. So it was quite a considerable set of things that we had to do. But because we had alignment, because we took time to get it organized in advance, we got through it, and, you know, I think we benefited from that. So that was a big moment.
Yeah.
I was, again, really fortunate. I had a great team that when they saw the facts, you know, they realized, okay, you're right, we got to do something. And we did it.
Yeah. You've talked about your team quite a bit today. So what qualities do you look for in leaders? So how many people are on your management team? I mean, you probably have a lot.
About a dozen.
A dozen. So
what I would say, again, you asked about becoming CEO. One of the biggest surprises to me literally on the day I became CEO, maybe there were 2 things. The first thing was realizing, it's all about the team. It's, you know, if it wasn't clear before then, it certainly became very clear on that, you know, that moment, that day. Oh boy, it's all about the team. And the other thing is, you know, that, you know, for better or worse, when you become CEO, people start interacting with you differently. And for me, that was, again, a little bit of an adjustment. I like, you know, being with the team and interacting with the team as one of the team. You know, when you become CEO, it's all about the people that, you know, that you're working with. And It's all about the leadership of the organization. You can't be any better than your leaders. So in other words, it's the quality of the leadership pool that you have assembled that determines how good you can be as an organization. And I think every CEO has that recognition, and therefore it's really all about creating the right environment for the team. You can have different styles and the different kinds of people on the team, but if everybody understands they're part of a team and they're working as part of a team, again, I have found you can accomplish great things that way. And I prefer working in that kind of an environment, so it has suited me well, and I guess I've attracted a team that's willing to be part of a team.
That's great. I'm going to shift a little bit because I'm sure a lot of people in this room are very interested in sort of the industry. Good. And it's one of the interesting facts that really has never resonated with me is that sort of the biopharma industry is one of the least liked in the US, right? Even though it's like one of the industries that provides the most benefits to individuals as humans. And so it's always been a conundrum for me following this industry, because when I meet with people like you and your peers and the scientists, you are so mission driven, right? Very, very mission driven. So talk about the industry backdrop, and we're in a particularly quite interesting period, maybe more unpredictable than it has been in history. So how do you think about the industry backdrop?
I would first reiterate what you said, which is certainly speaking for Amgen. Amgen is a mission-driven organization. Everybody who works at the company is driven by the idea that they can make a difference for somebody who's suffering from serious illness. That is the single most important factor which explains what it is that we do morning to night. People may not come to the company understanding the importance of that, but the people who stay come to deeply appreciate it, and many of them choose not to leave because that becomes a special part of what they do. So this mission-driven thing is real. I suspect it's real at other companies in the industry as well. And we work hard and do risky things because we have the privilege of seeing the people who need that, the breakthroughs and benefit from it. Then the flip side of it is, as you said, we live in a system where the transactions in our industry are very opaque. People don't understand what happens when the drug leaves the drug company and goes through the transaction processes that result in a copay, for all of you or for your families, either at the pharmacy counter or in the hospital. It happens to our staff too, and it's maddening when you find that somebody is, marking up one of your products tenfold and then charging you for the tenfold marked up product that they're administering to you or to one of your family members. And so we have a system, again, where the transactions are not well understood even by industry insiders. The consequence of the system that has evolved over time is that more than 50% of the revenues in the industry, more than 50% of the revenues associated with drugs in this country are in the hands of people other than the drug innovators. So we use the term middlemen, and there are a variety of middlemen that are involved in the drug industry, and they're abiding by a set of rules and guidelines that have been established over decades that affect what they do day in and day out. I'm not saying what they're doing is wrong or illegitimate. It's just that we have a strange artifact that has developed where we don't really have control over the price that consumers pay for our medicines. And I think that's part of the frustration. We also have a system where, for whatever reason, if you fall and break a hip and you go to one of our wonderful hospitals to have that hip repaired, your out-of-pocket cost as a fraction of the total expense is going to be very small. If you go to take a medicine that would prevent that hip from fracturing in the first place, your out-of-pocket expenses for that medicine are likely to be very high. So we have these distorted incentives which are causing problems across the landscape, and it's a huge source of frustration for us, for all of you, and for many others as well.
Well, what do you think? Do you envision any change on this? I know there's a lot now in the press. I think as of yesterday there was a big announcement by one of your peers. Do you think there'll be change? Or
I think there will. I think we have to expect that there will continue to be pressure on prices in our industry. And again, there are a couple things going on there, and this is true globally. We live on an aging planet. Right? We live in communities that are growing older. The fastest growing segments of our population are the 65 and older segment of the population. And the diseases we struggle with are diseases of the aging process. Cardiovascular disease is a disease of the aging process. Cancer is a disease of the aging process. Dementias are diseases of the aging process. So as people get older, they're more prone to these illnesses that require consumption of drugs and medicines. Most of the drugs are paid for by government outside the United States. It's almost entirely by governments. Even in the United States, the U.S. is footing half the bill. So you have the fastest growing segment of the population consuming more and more medicines, looking for innovative medicines that will make a difference. You know, every 40 seconds, somebody in this country has a heart attack. Every 42 seconds, a stroke. So we need more innovation to address those problems. Fortunately, the innovation in the industry has never been better. And the innovation is emerging to treat those unmet medical needs. So you have this huge demand side, which is patient aging, and you have the supply, which is exciting innovation to address those areas of unmet medical need. And the clash then is how we're going to pay for it. And that's what you see spilling out, on the front page of the newspapers day in and day out. Some of it is due to frank profiteering, we can address that. Some of it is due to other things. But the one issue on which Democrats and Republicans can agree is that drug prices are an issue for the voting constituencies that both sides deal with. So there are lots of things we could do better. The industry has been, and Amgen has been advocating for changes, and we will continue to advocate for changes. We'd like to advocate for those changes in the setting of an industry that can continue to innovate, an industry that can continue to bring forward medicines that people need. We think that the proposition we have for society is a good one. We think if we were able to stand up and show you, the numbers, here's what society gets if we invest in innovation, we would all agree that's great. Why don't we do that? Why wait for a woman to fall and fracture and break her hip and fix that hip in a hospital with brilliant surgeons when the fracture could have been prevented in the first place? And yet we live in a country where fewer women are treated for the risk of that fracture today than when the iPhone was first launched. Well, that's crazy. Why live and fix heart attacks and strokes that could be prevented in the first place? The innovation is available. It gets back to the access question. There are two aspects to Dr. King's access, health disparity point. One is that patient who learns they have a relapsed small cell lung cancer and asks the doctor, is there anything for me? And has to wait for the doctor to say, no, I'm afraid there's nothing else available. And companies like Amgen, we have, the privilege, the excitement of being able to say, well, actually, we've just shown we do have something for that patient. We have a brand new innovative medicine that we think may work well for that patient whose small cell lung cancer has advanced. So that's when you're able to bring access to a cutting edge medicine for something that would otherwise have been a death sentence for a patient, that's exciting. Then the second access question is, how do you handle that moment when the patient has to say to the doctor, what does it cost? Can I afford it? And there's nothing more frustrating for all of us in this game than the idea that there's an innovation available that would make a difference for a patient and a patient can't get it. And so what we, and I know others in the industry, work hard to understand is what's preventing them from being able to get that medicine at the moment that they need it. Whether it's the breakthrough cancer medicine or whether it's the patient that's at risk of a heart attack, what's preventing them from being able to take the right medicine at the right time? And those are the barriers that we want to take down. There are many different barriers. They occur in many different settings. So there's not one simple, easy fix. But again, we would like to continue to advocate for changes that will enable the innovation, the investment in risky research and development to continue. And we'd like to make sure that as many patients as possible can benefit when that innovation is available.
So I have 1 to 2 more questions, and then we'll begin to open it up so you can start thinking about what's on your minds. You mentioned this, and I think for the benefit of the room, it is such an exciting period it's almost a revolutionary period in biology. So why don't you just share with everyone why that's the case, and then if we dream big out the next 10, 20, 30 years, what could happen?
Oh, it's staggering what could happen. So maybe an easy place to start is with the idea that what all life has in common, what all of us have in common, everything that we consider alive in the biosphere that we live in has in common is DNA. Right? So DNA is what provides the instructions for life. And For about the last decade, maybe 11 years now, we've been able to read that DNA at the level of the single nucleotides. We've been able to read every letter at a cost and speed that makes it practical to do that. So imagine for a moment that it's really just, just about a decade of time in which we've been able to understand at the level of resolution of the molecule that explains how we're all alike or different, what's going on. So we can look at disease and say, why are some people succumbing to the disease or susceptible to it and others resistant to it? And begin to understand that at the level of, again, this notion of the single nucleotide. Well, what you quickly begin to recognize is, okay, that sounds like a kind of a digital challenge. If all life is comprised of 4 letters and you can read the sequence of those letters and compare those who are well with those who are unwell and say, well, can I learn anything from the different sequence of letters? The answer is yes. And again, quickly, I'm sure what you begin to recognize is, well, that then becomes a big computational challenge. And so you have, this moment where biology, insight, and digital capability are coming together to create truly extraordinary breakthroughs. And that's part of what we are seeing. So this is still the early innings of being able to interact in this world of digital biology. And so much of the progress that we've all enjoyed over the course of the last few decades in our lives has been driven by progress in digital processes and computing. And biology is benefiting from that now, and we will continue to over the next 10, 20, 30 years. AI will be part of it for sure, but big data and the insights that arise from crunching the big data is the foundation.
So maybe my last question, and then we'll open it up. So how do you then, as a CEO and leader, when there's just so many possibilities, sort of focus? And I think you said you can only, sometimes CEOs, maybe even late in their tenures, focus on too much. So how do you focus your organization on taking advantage of this sort of revolutionary time to? Yeah.
Well, we're fortunate. Our owners impose discipline on us, and it is easy to get excited and branch out into lots of different areas. But we have a pretty clear compact, I think, with our shareholders. We tell our shareholders what we are focused on, the areas where we're going to invest effort, and then we're accountable to them for doing that and for not straying into other areas. We try to be very clear. If we're going to look at other areas, we'll explain the rationale for why and try to make a case that we can do it sensibly with your capital. But so focus is important, and again, making sure that 30,000 people understand what that focus is. And so, in our case, we talk about the 4 areas where we're active, and everybody understands from a research or other perspective that that's where they need to be concentrating their efforts. So occasionally something will happen in a different area, but in those circumstances, we can review and say, gee, should we invest further effort or move on and let somebody else have that insight? And again, focus and making sure you have an organization that's aligned around that focus principle, set of focus principles is the key.
Do we have any questions?
Your career path fascinates me. I don't know that many people who spend 20 years in banking and then take an operating role in a large biopharma organization. I don't know about my friends here at Wellington, but I don't know that many people. So I'm curious what it was about you that enabled you to make that transition at that point in your career, what was challenging about it, but then also how it impacted how you think about talent now.
Well, again, I was very lucky, fortunate that some people at Amgen were willing to take a shot on me. And I think part of the reason they were willing to take that shot was that I looked different. My background, the experiences I'd had, the way I looked at the industry was different from others inside the company. So it speaks to the importance of having diversity of perspective on the team. I had lived internationally as well, and the company spent 17 years abroad, and so the company was beginning to grow internationally, and having somebody comfortable in that milieu, I think, was important. So I had some of the attributes that the company probably needed for the next stage in its development, and I was lucky that the company had a few leaders who could see that might be the case. So I do think it's important to have a mix. We all talk about diversity, and there are lots of ways in which to measure it and assess it, but the best decisions are ones that are made around tables where there are very, very different perspectives represented, and those can be racial, cultural, geographic, industry, but the more different takes we have on issues, the better. So I like to see that. I like to see people that, again, comfortable working on teams, people that are comfortable being aligned to a mission, people who want to be part of something bigger than just their own career. And I think our industry creates a substrate for attracting those kinds of people. And I think our organization creates a mechanism for developing them and nurturing them and giving them a chance to feel that they're doing something that really matters. So, we all work hard. Everybody in this room works hard. And hopefully you all have that feeling when you go home that, that you're making a difference and you're doing something you feel good about. And I think, again, in our case, we just have had the great fortune of being able to change people's lives with innovative medicines. And that is an incredible gift for all of us that keeps us all going.
You are right, though. There hasn't been many transitions from banking to the CEO role. Yeah.
It's more common in Europe. It's it's less common here. And again, I'm surprised how few people, when I look back on it, are willing to make a big transition in their life. It feels like, I suppose it was a bigger risk than I realized. I wasn't intimidated or worried about the risk. I was excited about the opportunity. And I encounter people all the time inside our organization and outside who I believe would make extraordinary contributions if they were willing to take the leap and do something very different. And not everybody's comfortable with that. So again, I was lucky that I was at a stage in my life where I could afford to take the risk, and I felt good about the people I was taking the risk with, and felt good about how it could all work out. But I think it's unfortunate that more people aren't prepared to just take the shot. And I think, again, one of the great things about this entrepreneurial moment that we're living in, writ large, the AI, technology, all that is, I think we see it every day. We're stimulated by these in particular, young people that are changing the world around us. They're taking their shots, and you can't make a shot you don't take. So every now and then you just got to take your shot.
So you've been a very successful CEO, and just wondering, as you enter into the next chapter here, do you approach it a little bit differently in years 10 plus, if you will, than where you were at year 4, certainly from year 1 or 2? But just wondering that you talk about the CEO cycles, if you will.
Yes, the answer is I feel it feels very different now from when I was just beginning. I would say there are 2 dimensions to that. One is that the world is so different today from what it was when I began. So pre-COVID there were a set of issues, COVID set of issues, and now post-COVID. So adaptation has been imposed on all of us. Okay, and so that alone is a big change. But the other thing is that as a CEO has been in the role for a while, it obviously becomes important to be grooming successors, and sometimes that grooming requires stepping back and letting other people take on opportunities that I might have taken on myself at an earlier stage of my career. So I enjoyed having sleeves rolled up. Perhaps at an earlier stage of my career, I probably would still enjoy it today, but there are some things I know I can't do that I need to give others a chance to do without me around, and to be able to observe and kind of hope that it provides the kind of development that they need to take on a job like this and be seen to be ready for it. Sorry, my watch is ringing here. Spam risk, it says. I don't know I don't think I'll take that one.
Yeah.
You talked about how much you valued the mentor that you had in your life, and I'm just curious about what you're like as a manager of people. So I guess 2 parts. Number 1, like if you're interviewing a senior executive, what kinds of questions do you ask to determine whether you think they're a fit for your team? And then what would your team say about what they've learned from you?
Gosh, there's a lot of questions there. I can do to you what I do to
Great
Jean's
question.
colleagues. I said, well,
Before you
answer one of those. Which one do you want me to answer?
Just one. The second. So if we had your team sitting here and you weren't in the room, what would they say they've learned from you as a leader?
Well, let me answer 2 questions. The first one, how would I be different from my mentor? I think there's an important observation in that. My mentor was, and I had the CEO who preceded me, as I've discussed, and I also have had throughout my CEO tenure somebody I go work with every month. We go hard at each other on strategy, and he's been an incredible mentor. But with respect to my predecessor and the role he played getting me ready, he's a natural. I mean, that's what he did. And one of the things I learned from him and from others is you have to be your own authentic self. So I can't try to mentor people the way he mentored me because we're different people. I don't do it as naturally as he did it. But what I think my team would say is that I think they would say I'm curious. I think they would say I'm taking input broadly from other industries, from changes that are happening around us, and bringing that in and trying to challenge us to rethink the way we do things based on stimuli from other sectors. I think they would say that I'm pretty forward-leaning and trying to look around corners. And I hope they would all agree that they've learned how to think about the long term differently by working on part of our team. We spend a lot of time aligning around our vision for the long term and then working back to what that means we have to do in the given year to avoid, we live in a long life cycle business, or we have to make long life cycle decisions. So we better run the company for the benefit of long-term growth. And that's what we try to do. And then we take our vision for the long term and say, okay, therefore, what do we have to do this year? And so I think that's a different style, a different operating rhythm than perhaps what many of my team have been used to. And then, we have a couple other little wrinkles that we've developed as a team that they would probably talk about. So, but this idea worked with the end in mind back to what you have to do now. And then we have a few ways that we keep each other abreast of what's happening in the next few years so that we don't have any surprises. We got problems coming, we get ready, start dealing with them early. So those kinds of things. So that might fit in the category of operating rhythm and then maybe some in the category of strategy.
Thank you.
Thank you.
Sorry. On behalf of our members and everybody here, a small gift from our friends at Bose. Thank you so much for joining us today.
Thank you. Pleasure.
Terrific job. Thank you, Jean.
Thank you.
We'll see you, everybody, in a month at the Boston Harbor Hotel for NASDAQ. Thank you.